Iqaluit. It is Friday, December 11th. As usual, Premier will start us off. He will discuss case numbers and some updates. Dr. Patterson will speak. And I just wanted to remind everybody that there won't be any news releases issued over the weekend. We will update the numbers on the website and put everything on Premier's social media. And just to let you know that next week we'll be doing the same schedule, which is Monday and Friday televised events. Thanks.
Wala sa kulo metal may December 11 sa bulik di ko sa kalangay at siyo ng mga ta luta para sa nakaw sa kasita ko pinasaya ko siyo nung ano sakit tayo yung kadyang ito sa katsani kasi ni sa bulik di Facebook ko nalunayak tayo katalangay tayo mga kalimalaw luta ko aperso lang ang mayo
Ublatia nubun mute Ublumim ticket lugo takwa nutango yunuban na yuakak to 16 takwa tamang milukta Arviat lundit nunubu iluani ublumim ticket lugo takwa 56 nuban na yuakak to amatakwa katilukta alwitay mga pigyakapta maliktaw yunubang yuakangi mga 5,339 Amatakwa 643 huli maliktaw yunuban na yuakangi mata. Amatakwa 189 Nunavut miut nuban na yuakalautut nuban na yuakaunnertut. Ikpa katimati luta takwa hiburirti lukta ama Prime Minister takayauti ko katimalawapta tan Prime Minister wot okalaw matak tan anya nuban na yuakta nangito kaput Moderna. Angyak tau himalak pat Canada iluan itakwa Nunavut miut 75% indakuting unam magtumi tikitit sinamata utaraw tigiligo takwa inu hitamo na pata pingahut kapiyaw yuluang oman tamang milukta Nunavut kapiyaw hata kuma kihanit tikika patakwa na magtumi 75% Nunavut miut innang nut tikit suma amatana Moderna tana numan na yuata ari kuti kaput kawi mayugutan Nunavut miu na machato manunubu iluan ni atok taw niya tay napakata na mangimat nigdidanak tumit atokaya man kihanita na Moderna huli angyak taw himang ito Canada me angyak taw pat matay molak pa kayuma taw toko tu takwa January February March milita tamong Nunavut iluan tikijuma man kawa hung naunelak tilugutan na adjung itu mit Nunavut miur kawa hung nakang na mata tan kawi mayung ayong nakituna kat nakatigiwa hokapta katingawa hokapta kihaniman na yo nakakwa nakatigi ngiluta takwa iglumyo kat pati kihimitai kanira iluti uglal duak tangiluta kanigi luang iluta talafo tikut ubalu bakay kayo kakato yakut uglaluk taluta tan mahan na atokop tigo tau tokok tung akago kowe hung naulik kanak patakwa pekko tokavuta tek mo tokumapta tamap talukta nalat siya kakapta takwa anya kailiti chikut malik tau ko yangin takwa agawang may chatalawit kanigi luak tangiluta ublal luak tangiluta kinapak himattaluta kanigi ila ungahik tigi ni ayokopta takwa maling ikuptigo taan nanuban na 19 nokay lang ikaptigo tay mo kay naktakama taan inung mataw hami inup kan na makihan ni aud latamat ama Nunavut miu nokay na mago ama Nunavut miu nokay yulo amago Arviat man nakihimi nuban na yakaman Arviat Tana malit siya lao labut anit tayo ko yung anit tayo lilutit matay ko nalat siya to Arviat ni mat na himat siya mak pagka kawi yung mga maayong nakit yung maman na tana pagkuhiya bot kihani tana nuvan na yuan nuvu ilo ni halagi naktabot. Good morning. Today Nunavut has 16 new cases of COVID-19 and they're all in Arviat. Nunavut now has a total of 56 active cases of COVID-19. The total number of persons followed to date is 5,339. There are 648 persons currently being followed, and 189 Nunavut have now recovered from the virus. At yesterday's First Minister's meeting, the Prime Minister assured me that Nunavut would get enough of the Moderna vaccine to vaccinate 75% of Nunavut's population over the age of 18. I am hopeful this will happen in the first quarter of 2021. We know Moderna, the vaccine that will work across our remote locations, still needs approval. In the meantime, we are working hard to develop our rollout plan and the logistics and the human resources necessary to administer the vaccine. As we get closer to the holidays, I want Nunavut to really understand what this season will look like. We need to prepare for a very different Christmas season. This means limited gathering and parties. This year, we need to celebrate virtually by phone or with distance, window, and porch visits. We need to stay apart this holiday so we have a chance to come together next Christmas. As always, please do your part, Nunavut, especially in those in Arviat. Please don't take any chances. As long as we have people not following the measures, we will see cases rise. It is up to you to stop the spread of COVID-19, and I'd like everyone to have a safe, enjoyable, restful weekend. Thank you.
Good morning. This week, the federal government announced approval of Pfizer's COVID-19 vaccine. As previously mentioned, the Pfizer vaccine storage and transport requirements, such as cold chain storage requirement of -80 Celsius and its sensitivity to transport, do not make it an appropriate choice for Nunavut. Nunavut is waiting for approval of the Moderna vaccine. Once approved, the delivery of this vaccine can begin. And as the Premier mentioned, we expect that in the first 3 months of 2021, Nunavut will receive enough doses to vaccinate 75% of adults living in the territory. The delivery of the vaccine will take into account the unique realities of our territory while ensuring that highest risk individuals, such as residents and caregivers in long-term care and elder centers, for example, are given priority when it comes to vaccine distribution. The details of delivery will depend on the timing of deliveries. These priorities are consistent with national recommendations on who should be considered highest priority for vaccination. After the high priority groups have received the vaccine, we will make it available to all Nunavut who are 18 and older, but to be clear, the exact timing of this will depend on the rate and timing of delivery to Nunavut.
Ulla sakkuta pani pinasakos ang miga pamatukak kunalo na sila ang atangik tao si maningan itana Pfizer Nunavut 19 mu kaputi. Daya mauhak si magatatan na Pfizer kaputi uyok. Tukok tao si magahak ni nga ulak tao si magahak ni nga tanga solo nilinak tumingin na ni -80 mi. Tana lo ulak tao ga ulugan ni nga nutana naman na jangit to Nunavut takiyuking ulak pa mangyak tao ga hamningan itana ay pang Moderna vaccine kaputi unirak toyok. Ang tao simulak katana kaputaw hatta kalalak to. Niriutugu takkini pingasuni sivulak pangin ni 2021 mi. Nunavut tako na matuni kapi hatta unalang at 75% in innang ni tamani Nunavut ni. Tana kaputi hatta lekatana sumasaksiru tayo hatta lang tajiging ito ni sakyo man guta hatta tamani Nunavut tamakko sumagilugi ulugan at tuminak pan solo tamakko ang ikahaktiyo yun ipigusutiyo yun lo innak kuvinni solo tako sivulyo jaw ni ato tamakko kapiyaw hatta palyalal kata tako iluling kano kapiyaw hatta lang mga ta naluna tawla to hangak ko mga ako sivulyo jaw lakto ukiulit 65 niyo nga tanullo tamakko alo ang ikahaktiyo innak kuvinni ikanayak ting tamakko pijit sirak patut amal tamakko anaham nang itulirin mo pijit sirak ting tamakko sivulyo jaw gali tay matsay nato kana tami atuliko jaw si mayo kikut sivulyo jaw gali kamanga ta kapiyaw lakto ni tako sivulyo jaw gali kata sivulyo jaw ko jaw si mayut kapiyaw si malagi kata Atu inakulatu Nunavut miulimanut 18 ni ukiulin ni ungatanullo. Kisani to kisinatsia kullugo hanga kullari una mga tamako sulinalo na tao na atu Nunavut me.
On Monday, I talked about the rapid testing program that began at the Winnipeg isolation hubs. Today, I will share another initiative that is underway to help reduce the risk of exposure to COVID-19 while reducing the stress that can be caused by current isolation requirements. The expedited medical travel isolation program will allow medical travelers attending certain low-risk appointments in southern Canada to isolate immediately upon arrival and return home usually within 7 days of leaving Nunavut. This program requires the medical traveler to stay at a Government of Nunavut isolation site before and after the appointments, use Government of Nunavut provided transportation for all medical appointments and for travel to and from the airport, not visit locations other than the isolation site, scheduled appointments and the airport, wear appropriate PPE during travel and appointment visits, follow all isolation requirements for the duration of their stay, adhere to the return travel requirements in place at the isolation sites, and participants who do not follow these rules will be removed from the program and will have to complete a full 14 days of isolation before returning home.
Nagkajami ako sa kayo gamata ko akila mi ko kayo sakta katak palana lang mata Winnipeg mi tuyo mi vingin ni pigalo ni pingat sang mi ulo mi ko sa kakamami yung asa ni pigat titaw si mayo mi taman na sakit taw valakan ni ko nagunuvad jan nak 19 taman na takan ako natilog taman na tuyo mi vini tuyo inutu anit tele kay na hamningin not tana khilami yo ko ana bila si mayo anit tele ko tuyo pili reakta ko ana bila to ta ko ulo na tumi ngitunik ana bila lo te khallo na ni kanatami Tako tuyo mi mo chau tiki gunak tu tiki palea amalo angi karunak sigun nalo ti ulo 7 tungani Nunavut minga lau tilugi. Kisene uko ana bela simayut ukuning amaligya khalla igayaktun. Ini khallo ti Nunavut gavamakung ini nalo na simayang ini tuyo mi vinni sibong agut kingune agullo takuyaw lau tilugi ini salang simayung ini. Atullo ti Nunavut gavamakung itatu inaw titangin ni Nuna siutikut upakatalu ni anna belalo ni anna belonut ubalo ni hangatayo kubimik tuyo mivimullo. Asingin na upakatang ilo ni tatsuma tuyo miviwasyanut amalo anna belak ninginut in upagakatangin no asingin nulo amalo hangatayo kubimut tako nung ato Atu China hatalo tita makuning naman nato ni timi mo sa pumiyaw gutinig aulak palaling mini amalo tako yaw na tilugo. Tako malit siya hatalo tilo na tito yung mivin ni malit taw gailin ni taw na nilimamin ni. Malit siya lo nilutan na utak na alo tilugo aulak gailin mi tako ningin to yung mivin ni malit taw gailin ni tako ning at China malin na lo ni. Tako ilaw kataw yu tamak ko nga malingi patatak ko nga ani taw gayak to pilirami kamalo tayo mau pigakan na kakali gayak to at ang yato ni ulo ni 14 na ani tayo ligahang ni mga kalawin ng mini.
This is not an opt-in program. Department of Health staff and the Office of the Chief Public Health Officer assess the eligibility of appointments based on treatment and procedure types. Travelers whose appointments are approved for this program will be notified by their health center.
Tana nalira ko tagun nang ito kinatuin ng mo. Anahan nang ito liriyo ko kanayak tingit ang malutat suma. Anahan nang ito liriyo alabing akawya sa kayak to kinakutamak ko nung ilaw katagun ng mga ta. Takuyaw bitsang imalit to gil kanulo inulisak taw gaya hamningin. Tako ala kaya tako yaw bitsangin nang yak taw gun natutat semua takawi kak taw kayak to nunalin na bengin ni.
Currently, up to 10 people a week have traveled on this program since it began in November. With case counts rising in the south, it is an effective way to reduce the chance of medical travelers being exposed to COVID-19. Finally, I would like to say matna to the communities of Arviat, Whale Cove, and Rankin Inlet and Savikataaq. This past month has not been easy for the residents of these communities and the Kivalliq region as a whole. While there is still work to be done to break transmission in Arviat, I thank everyone who has cooperated with these public health measures. It is those efforts that will help us get through this. Thank you.
Manoyok tako huli uhatak te binasa ako si tamata ma aula kay nakasat so si tatsi mga kilami unak to kupigay alo sa mama November mi. Tako amis akong panlangin nak tilugi ta mga kalunan inuwad jo anak takatak to taman na aula nakatsa ako nak to tamak ko anak bilayat to sakyabi ako naginuwad jo anak 19 mo. Kingunlak pa mi tako amak naktak ka nunalingit Arviat tikirat jo kanya sanikilo alo. Takku semai mita ko ayom nak tukku semua takku nunalin ni tu kivallermi lo atangyak tukin. Suli atsu tukalo aktilutas nukat tutahulu gusar makpanleani akveani. Huyan na may rumayak katamak ko ekayom nakat siya semai malit siya semalu ti anna hamnang itulirin ang mamalit tau galin ni. Takku tagak churuti si tayo mata vani guti ni akabutay may malit nat siya tu akutsi. Huyan na may.
Ken Driscoll, APTN National News. Dr. Patterson, you identified some of the groups who will be receiving the vaccine first. People at high risk, first responding medical personnel. I'm wondering about the science behind giving it to an affected community. For example, does it make sense, since so many cases are in Arviat, for you guys to prioritize Arviat when it comes to getting the vaccine?
Ketris ko APTN ko niluta Patterson tan nakaputi ulato kau Savikataaq uluran nak tuminak sa musivuliw titaw na nga solo tamakko ni nga kanayak tinutubalaan na hanang itulirin ng mun. Tayo makaway saktulirin ko nalunayak taw si mabasulo tamakko sa mabiw si mayusulo akvani sivuliw tsaw kaya kakayak mga ta.
We don't know enough about any of these vaccines to know for sure which ones, if any, will work in the way that's required to intervene in an ongoing outbreak like that.
Kaya mga ituguman na yung sulitamak ko nga ilulingin ni naliato tihat naksaw kaya mga nukakit sigoy taulo ni sa mapalaya yun.
Some vaccines protect you from the effects of the infection or the worst effects of the disease. So you get the vaccine, you can still get the infection, but you're much less likely to wind up in hospital or need other treatment like that. Some vaccines provide protection by preventing you from getting the disease at all. And so in that case, those vaccines can be used to break transmission, to stop outbreaks literally in their tracks. And we just don't have information on any of these vaccines yet. If that sort of information on these vaccines, we know they protect from hospitalization. If anywhere along the line we get new information that they can be used to break transmission, that would be a game changer for not only for Arviat but for many communities affected by outbreaks. Sorry, Oli.
Yeah. Tamak ko ilang kaputi ilang picture ta hatangata sa pumiya ko na hulog tamak ko kepeyaw sa mayo solo sa mabiute ligo na sa hulog ta sa mga kaputi ko amalo unit teli ila uning ginasa katakayak to kanoy guti kalingin sa katakayak to kepeyaw sa mayo ilang iluta ko kaputi na pedyo ta kasulo ti sa maktit sitay nak mot ima nuwadyan nak tay ligon nat sa na kayak to taman na sa mapalyan nga nakati taw lata ko nak to tamak kuno kasi ani man na yo to kisuti ni naluna sa mayo hangin mata ko kaputi tamakini tamak kuno nga sakto taw na mga kasi ani sa pumigo taw na kaya nga tamang na unit teligan ila uningin sa katakon na namuan na be mo kanin malawat tayo ligaw tao nakasagod na nangin no kawiyaw si mayok. Nutaan ito kasi sigod tamak ko anala nukatit sigod tao na mga sayang magutaw na ito ni taman na asidyo ko tao na kayak to so lumaan na yak ba ni tayo may guti kakata kasi na kawiyaw sakpalayawin na nangin ni kawiyaw magkaswangin na nakto.
Dr. Patterson, I'm wondering, will people who take the vaccine be able to skip the 14 days in the quarantine hubs in the south if they travel?
Luta Patterson takwa kapiyo yuminyo hatalik katata mahulu ni 14 ni aniteliga karunni kaya kakaluna ni tamang utakpanya tilogi.
No, not right now, because again, we don't know if the vaccines work to break transmission.
Aga mana yo aga kaya manginatata ko sa mapalati sigunan na minukhat sigud na mga tasule.
Emma Tran for the Canadian Press. My questions are for the Premier. Yesterday, Yukon announced its plan to roll out the Moderna vaccine in the new year. This afternoon, the NWT is doing the same. When will Nunavut announce its plan to roll out the vaccine?
Emma Tran for Canadian Press kun ne patso ho sa kalaw bitan na Moderna tawlak palay ngab ni ngani kaputyo yo. Khali malawak tilo si khanga ta na Nunavut matu na kulak so review.
Thank you. We're still working on our rollout plan, and we will have all the logistics figured out before the vaccine is here. Tana huli piliraya wutana kaputi anya kang nangito ko nuban na yami. Tana kaput Nunavut ilon tikakatani wutana kano piliraya na kiyo kitu kapiyo kana mangata nandianuli tana huli piliraya.
The Moderna vaccine still needs to be stored at -20. Will we get freezers in Nunavut to store the vaccine? Have you had a conversation with the Prime Minister about how that will work?
Tana go tsokho taw sa magahanga taw ta na Moderna kaputi -20 mi. Ang iyo kadya kanata mi tama tumamitsa no kano kamagayaw la mga wakatigilaw kayo.
Yes, the Prime Minister has assured us. First, I'd like to thank him because he has made a commitment that Nunavut and the three territories will have enough vaccine of Moderna to do 75% of their adult population. And yes, we will have the capability to store this properly in all the communities. Thank you. Itana Prime Minister matnawa kaso ikpakaw kalaw matana Moderna anya kang nangito nuwan na yami Nunavut mo matakwa ukiw taktut NWT ama Yukon mo tana Moderna mi pigupta takwa 75% takwa inokotibut kapiyo yu lang na mata ama itana -20 mi tokok himaga kang matana nunalukta ta ayung ginyak to tokot salawatana.
Toby utak CBC kunni tan Luke Damu Duranga Komat. This is for Patterson, Dr. Patterson. Tema Nunavut ikarung ng mute inugyak langung mat Nunaring miulo ikarung nutikit kayuk paglutitlo anarving mulo katimayaktong ng mulo kisani ulum yung ngikaroktok kanoy ma Nunavut kabamangat aksurote kangipat Pfizer tikitin nasung ng mo ikarung miunun a large chunk of Nunavut lives in Iqaluit, and a lot comes by for medical mainly today. Why isn't Nunavut making any efforts to getting the Pfizer vaccine in Iqaluit?
Because the logistical challenges associated with the Pfizer vaccine make it very impractical for smaller centers. Would take a lot of work to get that done, and it would only benefit one community in Nunavut. Whereas if we put the work into Moderna, and plan and prepare for that, we can ensure that as soon as that's available, it will have benefits to all Nunavut.
Pinakanitan na Kano parnau tau kaswaka nga aulak tau hattaka nga tahan natsur na lua kayang nga tahan na Pfizer kaputi na mana kayang matamalu pila ngola gia kalua kayang nga tahan na pivale ko tau kun na kayang suni atau situang munu na limunu na vumi tayo may matakwa Moderna nga amik tayo matukag kakangalak ko takwa no na vumi uli matuin na katsau tiyo kudlug atau chiko.
Tagvaritakwat Inui Nunavut Kallunani Nunakaktuit Uparuni Anak Viraksimayut Pfizer meet Kaputik Sami Kapiyo Yun Nakayakpat. There are many Nunavut who resides down south and are also in down south for medical. Can the Nunavut get the Pfizer vaccine?
It depends on the jurisdiction they're in, and it's not up to me or to Nunavut. It's being supplied at the provincial territorial level and would have to be consistent with their policies wherever they are at the moment.
Tana maligya ka ila dako Victor sama view tay ko atoy nautit si patatat sa mga kaputi may naminik nalo na sa katakayak to tay ko no na vumyo taw na nito nala nito na tay may timi kapiyaw ga kayang mga
Megan Dooling, Nunatsiaq News. I know you're still working on the rollout plan. Will it, do you know, include a public education campaign about the Moderna vaccine, and what will that look like?
Megan Dooling Nunatsiaq ni kaw yung magalawak ng sulipam na utaw wala makanutak ko kaputi sakit taw wala lamang ata kasi anilin niya ati siga sa diyo milaki tats mga Moderna kaputi mitsano ang balok ano ilang alaka.
Yeah, it will. The communications plan will cover what people should expect in terms of side effects, what they should expect in timing, like when they'll be available to get it, how they can access it, and ensuring that they know when to come back for their second dose, all of those things, and we'll answer as many questions as possible in those communications.
Taman na to sakit siya na mapang nautitan na pidyutihan na tuta ko amisu na sa yut kanok at tutaw na kakayang mga takapiyaw lutik ang maluhangak ko kayang mga kanu kayang mga kamalutudlian na hangak ko kapiyaw kanirato kakayang mga tamak ko kiw kaswakat na kayak tavud apik kutiw niyo sa yut sibok nga ko to sakit siya katang luta.
And obviously I think it's going to come up a lot here, and we'll be discussing a lot of those details at press conferences as well. And one last thing I forgot to add into Toby's question, and it's really important, if somebody is down south and gets a first dose of a vaccine, they need to plan on getting that second dose probably from there. So if somebody is in another jurisdiction and gets first dose with the Pfizer vaccine and then returns to Nunavut, we won't have it, and we will have to start all over again with the Moderna. If somebody gets Moderna vaccine down south and then returns to Nunavut, and it's more than, I think it's going to be about 35 days later, we would also have to restart. So
Restart
the whole vaccine if it's more than 35 days.
Taman na nalunang itapik ko tiyo walangin na katalaga yung kamalo nalunang sa katalaga yung gusto lumaan na tusaktit siya tu katatilo ta na tao king lapat ho biapik ko tiyo katakta nga sulo kaluna ni kapiyaw yung ham na akad sulo Pfizer mi pilo ang ngap tamitan na tao na ni tudla ni kapiyaw kan na kakayak to tamani pitakadjang ma Pfizer mi tan na tudla ni kapiyaw gunnang ipatama ni pigalak kan khattaga khayak to taman na Moderna mi pigalak gutawlo ni tan naluli kisa ni Moderna mo kapiyaw yo ham na khat tudla ni tamani kapiyaw gunna kayak to gala ulloy 35 tungani ngito akan.
UConn said yesterday during this announcement that they made that they were aiming for 70% of the adult population to be vaccinated to reach herd immunity. What is Nunavut's specific target to reach herd immunity?
Yukaan me maksimum matay pat sa tiraga ham na rato titako ago 70% tingi no hutingi takapiya uga soalam na rasugit. Tamak ko ino hatigi anna majuti tarun na sa hulugit. Hanulay no na vumitoraga hakan.
We want to protect as many Nunavummiut as possible, especially in higher risk groups. The 75% figure is really, we know or we believe that we're going to get enough vaccine to vaccinate 75% of adults somewhere in the first quarter of 2021. But if later on we can get more vaccine and carry on and offer it to other people who've now become eligible, we'll continue to offer it.
Ami suna pa ngo kaswak nila no vumio na sa pumigo maniakat tapilo ak tumita makuning ulaga nak tumin na sagun nak tuni. Tay malito kaga hakto 75% nginni kapiya huyiluta naman na palay mata 75% innay tay makapiya gum nak silutik. Tako takit pingaso sivulak pangin ni 2021 mitay ko tay maturaga haktugut. Kingunago tako ame ko hakata malo kaputi takan na kun naruta singin not tay matuin na tigun na lambia butan na kaputi.
Are you confident that 75% of Nunavut will come forward to be vaccinated?
Nalong nila tikay tako 75% ni Nunavut atuin na imao pagutila kalo mga takapiyaw gak to hataluti.
Previous experience and based on previous experience with pandemics like H1N1 in 2009, yes.
Kingunit din yatok sumayat tigo takulugi solo pilo ato mi H1N1 lagitilo ta 2009 mi amis so kapiyaw hatta yung mata itay mataw nalong itong amis so kapiyaw hatta kung na gumalangat.
Trevor Wright, Nunavut News. Given how some people jump to conclusions and all of that, what would you say to people who are experiencing side effects of the future vaccine?
Trevor Wright, Nunavut News kun nitako ilangi tako isumami ni akitsit sa uti katangata kanulika koti kun nakikita mako timimino at toktaw guti kun namningin no tamako kaputi.
Every vaccine or most vaccines will have some minor side effects associated with it that are 1 or 2% of people will, or a small percentage of people will get. There will be some very rare side effects potentially, but we don't know, not having seen all the details on the vaccine, I can't comment on those. But by the time the vaccine's administered, any of those questions will either be available in the communications plan or people have every right to ask their healthcare providers what the side effects are and what to do about them when they're getting their vaccine.
Tako hanutuin na kapiyaw yo ham na tilugo nalo nang ito matimi mo hanutuin na atok na kanew sa tuin nang 1 or 2% ngini tamako ilangit timimino piungin na taw gunak to galwat. Kisa ni may kayong ito. Kisa na ilulingin na kaya mangin na masulit tamako kano. Tako ano ta kaputi kano at tuin na haun na mga ata. Kisa ni kapiyaw vanlealak tilugi tayo mata mako kyudjuta kanirun nam naksaw katalak to tamalo to sa matin sinik ko pang nautik ko to sa matin siga katalak mayugo tamalo ana ham nang ituliri ko nun. Ila kapisi yun wapik sutsa katakon na lang mayu.
Talking about the low-risk medical travel program, who are patients who are considered low-risk medical travelers?
Tako lo anak tumingin na sa ana bila to kilamiyo yukko ti katakon nam nakakaw gawigi kikko watamakko lo anak nitumin naksay tako yaw katakali.
Do you mean the expedited medical travel isolation program?
Yeah.
It's based on the appointment, the nature of their visits in the south. So typically they're going south for 1 or 2 appointments where they'll be relatively quick and very unlikely to be exposed to COVID-19.
Tanay la kilamiyo yukko ana bila tunu uti sakay titsakat tanang mo tako yaw gatok tuni. At sige kata dyan ito kisuni tako yaw gatok ti mga takalunani ataus na mimakuni luni ni salio taus maluti kamaluta ko ti sakay na nakaktaus suripata tay mataga Nunavut juan na mo sakhibiw tay titaw luti tay maawla kay nasak titaw hatakon nakto.
Ken Driscoll, APTN National News. Dr. Patterson, we've asked you this before, and I'm wondering about people who have been sent south for medical treatment due to COVID-19 complications. You've said before that you won't tell us that number unless it's more than 5. I'm wondering, is it more or less than 5 now?
Just ko ipicture ko niluta Patterson naperisima yakalawa kataan na tamako halunale aptito si mayo tamako pidute haksuti Nunavut juan ng 19 mo akagunne ko te haksima ningin not ukalaw ka bitan limaw pataw nga talon rune ukakon naksibit tan limaw lang mga taw nga tanon lone.
It's still less than 5.
Sulit tan lima tunga nito.
And you put in rapid testing in the Winnipeg travel hub as basically an extra layer of protection. Does it make sense to do that in Arviat as well, considering the amount of infections in Arviat?
Tako kila may yuko ka isa ko tini utikon nakto ni Winnipeg may ukaw sa kalaw kabit. Taman na sa puti yaw kan na kung nakulugo tayo malaka Arviat ni tayo may kung naksingin mata.
It's potentially an option when the circumstances are right, when we have enough and we have capacity to do that. But the nature of the rapid testing, they're not a complete replacement for the PCR testing. So in most of the circumstances, all of the circumstances that we're testing in Arviat, we would still need to send out for a confirmatory test. And we're getting those results usually within 48 hours right now. So, not right now.
Taman na nalira ko tiyon na tuwin na kaya liw galawa na manaw na kat amalo piliri sa katsakong na nakatakaw sa akong naktunik. Kasi nita na kila may uyok ko kaway sa ako tiyo king uvi ko tagon nang imatat sa mga kaway sa ako tilatango yung PCR ng nakaktaw yami. Kasi ni man na uyok Arviat ni tayo manalo na tayo kakaulat tayo luti kasi ni ukatayang asuli. Ang maluman na yung 48 ikakay nagay matal utikong naksakat takatuak tiluguman na yung kana Arviat na kila may uyok ko kaway sa ako tiyo sakataw dyan ito.
I'm going to turn to the Canadian press. Will the Canadian military be involved in the distribution of vaccines in Nunavut?
I'm trying to Canadian press kunita ko kanata may unalit sa yakoy kayo kataw na katamako kaputi atoy na walala kata.
Right now, they're organizing the logistics for Government of Canada and with their involvement with the Public Health Agency of Canada. So they'll certainly be involved with the delivery from in the south to our reception centers in Nunavut. The delivery from there to the communities prior to administration will probably just be done by GN staff. The arrangement of it anyway, whether it'll be through scheduled flights or charters, we haven't figured out yet.
Mana yo tako suli pamataw wala mata kanataw gava makungin ni tako anahan nang itulira yakto ako timiyo yu kanata milaw kataw lutik kano awla taw na mga lihan taw na nikalo na ni manilo Nunavut amano tako kaputi ato na wala kata kano nunalino taw na mga ta Nunavut gava makungin no kapayaw tuin nam na palayo kisi ani suli init sa liyo taos ni mayo ko hangata yukod o balo hangata titaw yukod awlak titaw katalang mga suli how you galivo.
Can you give us an update on how the rapid testing program is going in Winnipeg? How many people have taken a rapid test? Has anyone tested positive for COVID-19?
Tako lumiwak to saktit siya kung nakita ko kila may ko kaya sa kuti Winnipeg may pigyak taw lak tilugit kat siya kaya saktaw si mabamalo nalo na taw si mayo kakanuban jo anak tulik ko tabuna.
I think in the first either 24 or 48 hours of operations, there was 11 or 12 people who entered into the program, and it's typically going to be 3 tests, and there was 1 individual who's tested positive.
3 tests?
3 tests on day 0, 5, and 14. Or sorry, day 0, the day they start, day 5, and day 12, just before they leave.
Sivullerpaami taakkoi kaqqai 2448 luani ko kasuartillugi taakkoi 1112 luuni taakkununga qauyissaqutinu qauyissartaulaortuun pingassuarti qauyissartauqattariaqangata sivullerpaangani ullungani tallimanganni 12 nganilu taakkua qauyissaqutioqattariaqartillugi kiseena taussermi tabbuuna naluneertaussimajoqartu nuvatjuarnaqtaarsimayumi
Tobiutak CBC kunni Tema Arviani inugeksikkannermingmat nuvakjuarnaq 19 taartortut arvermiut qanuiluurunnarpat nunalinginni aittorluikataktailimanassunnermit soorlu qavisartitaarunnarpa unnukkut kikkullu qavisarunnerajarpan. With the new cases that showed up today, sounds like there's a community transmission going on. What can the community do to prevent this from happening? Can there be patrolmen? And if so, who could take care of that?
Some of that's up to the community and some of that's up to individual choice and participation. There are, there's concerns that there's some people continuing to visit other people, visit people in houses that aren't their own, moving back and forth. All of those things, those are choices that increase the risk and continue the spread of this infection.
Takkua nunali taimai gunnamanga minammin nalunarsissamagunnartut atunillu inui taimaa niruarunnat seartu ilauqataugumammagaarmi kayoqataugumammagaarmi suulu pulaariaqattarunniit saamarillutik ta ilangisuli pulaariaqattarninginni tusarnaqattangat utiqtaaqattarsutillu tamakkua takkan taima inuusermini taima iluaqumatuaruti taima uluqianartumiititsigu tamatamigaassaarmartitsikunnarnermu assiminu.
I think, though, it's important to remember that people face pressures and circumstances that we don't fully understand, and providing or developing creative ways to support people in isolation is just as important as some of the enforcement measures that we've talked about.
Pimariuvungila takkua suulu qaujortauqaginnaqattariaqarningit tamakkua tukisumatsaarunnakullugi tamakkua alu aaqitsuilutaaqanu akaqqiyaaritaugunnartuni kajortsuutaugunnartuni anittailittitautillugi imaamalittaukkaigassaarniussillataagu.
If those patrols are to go on, who can they contact to give fines or something?
Inoptit.
Kayo sila karong takuat qawisaqunnersikpat kikkunnu unnerluugunnaqayarpat.
There's an enforcement program within the government of Nunavut, and so if there's right within the public health orders, there are professions designated as being involved in and having the authority to lay fines, and if there's going to be any patrolling, it should be those types of people, and that it's not something that I think is necessarily useful, but taking those opportunities for education would be my first choice, and definitely don't want to encourage in any way, shape, or form any kind of vigilantism or rogue contact tracing or that sort of stuff, because that is definitely not helpful.
Tamakua malittaukkainarmu pileraaqangata Nunavugavamakkunginni suulu tamakua annaahamnangittulerinaarmu malittaugaali nalunaarsissimammata kinakku malittaukaigunnaarmangaata kinakkullu sanginniqarmangaata malittaukaigunnaarnermi suulu kiinaujarni akiliititsigunnanarmi tamakua suulu atuutiqarsuinginnattigu aturtaunerlutuinnariaqarninginnu tammalu tamakua Akiraktu taulikin naraahongin nukisani taikua ilinnaartit sinarmi tukisiumatit sinarmi sivilliutit sigasoaqatta.
Numiana. Tapsunga ilagay ako mablugo takwa akvermiutaw katigo nunavumhiutaw katigo. Maligiali takwa pingwangong itummakialong mata maliktaw kudlattakalo akaptigut. Amisu akvermiutait, amisu naksakadlait, maliktut nalaktut ubdutama takalang matattaw. Nahalag ng miyong ito kisiyani. Nalang ito ni ani yumayutta ngukwa ami sumakero inu nakatisi ani yumalik kaming ito nahalaga sumu anit tailiyun ami sung ito ni okaw sa kaktugut nalang ito ni. You know, I just want to stress to our fellow Nunavut in Arviat that please listen to the request of health and the doctor and the premier. Listen to the rules. Listen to what we're asking, because many more people in Arviat that are listening are also getting tired. They too want to go out. They too want to visit, but they cannot until everybody stops visiting and not wearing masks and breaking the rules. If you would listen for 2 weeks, this could all go away. This is so preventable. Just listen. Naalalaw ritsi. Uglakakatang ilaw ritsi. Taima. Anyak to kakatak to amisunig arveni. Naglingnak si tiya katang mata naalalaw ritsi. Ikpag sa uglalaw ta si kanuing itiyalaw tugalot. Ublumi kanuit to kalak tuin nakayakang mata. Ublumi itiruktik. Kanuit to kaktidlugit. Taham nanak sa tuwin na kaya kaktait. Taikang nat iglungnut, ama asingin no iglunut. The people you have visited yesterday, they may have been very healthy, but if they had contacted the virus since then, and you visit them, you will now be in contact with it and bring it to the next house you go to. This is very serious. Please stop visiting. Please stop allowing visitors to your house. You know who you are. If you've been told that you have the virus and that you've tested positive, please stop people in your house from visiting. Please stop people from visiting your house. It's very simple. Ayong nangito na ukaw jaw si magubit, nalunak taw si magubit, nubagyo ang nakaktutit, iglumyo katitidlunit, nubagyo ang nakaktumik, nalunak taw si magupsi, uglakang ngilaritsi. Uglak ti kakatang ngilaritsi. Taman na tukisin na tiyak tok takalaktut arvermiutay. Tamatuminga nalang itunik, nalakat nalalaritsi. Salagayon naktasiw na. Ang inaksakad lang magarong ni aksarong naktunig atok si mayo si arvermiusigut. Salagi si mayasi. Anigok ti si mayasi. Ayong itusi. Arviat have endured a lot of pain and a lot of hardship over the years. Some of it a lot harder than what they're going through right now. They overcame all those obstacles. You can overcome this. Unite and fight it together. You have our support. Anyak tulira yigayasitaw, takakatang mata, takalak tunaro ng ito. Ikayo kumanirmot, aksurok ublutamad, unutamad. Your health workers that are there are doing a tremendous job in trying to keep this under control. They are getting tired. So too are many caregivers across this country. Help them by helping yourself. Stop going out and stop letting people from coming to your house. Wait 2 weeks and this will be done. Uglakakatang ilawatsi, uglakti kakakatang ilawatsi. Sanat tayo ni makuhaan, iyon nakto na. Kuvaya sugviksiw tiya on nakto si suli. Ublumi, nukkaon na op si tamatuminga. That's all I wanted to say. This is getting very hard for our fellow Nunavut and Arviat. Tam no ka umatuin nakawaya ka. Nukkagaya kalagaro mataman na anyang Ikayok tayo magupsi, Taikununga Iqaluit no Iqaluglusi Ikayokto yun nagtiaktasi. If you need help and support, please feel free to call our toll-free number, and people on those phones will be more than happy to give the support that you require. Thank you.
Megan Dooley, Nunatsiaq News. I have a question for Dr. Patterson, please. You mentioned in your opening remarks about the expedited medical travel isolation program, something about, could you clarify if people have already been doing the reduced isolation in November?
Megan Dooley Nunatsiaq Unitana Hoseriqqa Arviat Naulam Naqsugu Lamiyuka Nabilato Niaulat Tsikatanermot Sakai Tsikatanermot. Bigger Togis Malaka Tamanano.